Hi, and welcome to this week's episode of Ask Dr. Jessica. Welcome, Lori Allen.
Hello, it's so nice to be here.
So I'm excited to have Lori here for many reasons, but we are going to talk about what Lori does. She's an MFT and she specializes in anxiety. And what I've really been interested as I've gotten to know Lori, I've seen her practice or talk to her, and her practice has grown tremendously over the last few years. When I first met her, she was a one-woman show working by herself in 2018. And since then, I think recently you told me you now have how many therapists in your
We have
office?
nine working
Nine
in
therapists.
various specialties.
Wow, wow. And with an emphasis on treating anxiety, correct? And a
We
multitude of
have
other.
a multitude of everything. So we certainly have a lot of practitioners who specialize in anxiety, but really we're a multidisciplinary group, and all of our providers specialize in treating various members of the family. So some will do children, some do adults, some work on anxiety, some work on addiction and trauma and relationships. So we have kind of a little bit of everything for everybody.
That's fantastic. I mean, I'm sure a lot of you listening can relate to this, but anxiety is such a normal part of what a lot of humans deal with. And then what we've been through recently with the pandemic and raising families and work, we've definitely seen anxiety seem more prevalent around us. So can you tell us what you do exactly, or tell us how it came to be that you started working in this field?
Okay, so my evolution from kind of solo practitioner to where we are today is I started working in 2006 in community mental health. I first started working with survivors of trauma in different community agencies and kind of worked my way up in the field. I think as something that happens with a lot of young professional women, I got married, and early in our marriage, we decided to move abroad. We moved abroad. We moved to Indonesia for a little bit. So I kind of took a break in working. I did some volunteer work there. And when we came back, I was expecting, and I was very late in my pregnancy and not at a place where I was going to enter back into any community agencies. So I had my son in early 2013. And it became very, very apparent very quickly that I was not meant to work in my home, that I was meant to work outside of my home. And I started my solo private practice with an emphasis in working with anxious kids when he was about 6 months old. So
Okay.
that's kind of what brought me into it, was this real desire to work back with families and with people in a helping capacity where I could utilize my skills. And so we kind of entered back in. And from there, I've evolved, I guess, into realizing that kids was really fun and it was great, and they had all these needs, but so many additional needs were actually coming from parents. And so the practice kind of evolved, and I evolved in the way that I worked to realized that families as a whole needed more support. And even though the kids were the reason people were making a phone call, they weren't really the part of the family that needed help, if that makes sense.
Yeah. So in other words, are you saying that kids almost learn anxious behavior from their parents, or they pick up on their parents' anxiety?
Yeah,
Okay.
I think kids are a mirror. And they're, or a mirror, maybe a tuning fork, right? That they pick up on the energy that's happening in the home. And so what would happen is we'd get these phone calls. I'd get these phone calls from parents who were telling me that their kids had anxiety, and that they needed to be treated, and they needed to be seen, and they needed to bring them in. And the way that I practice, and the way that I think that practitioners who work with children should practice, is that you work with the parent first. So those sessions, parent caregiver would come in first. They would download us on everything that was happening, and it was a reflection of what was happening for them. They were overworked, they were overwhelmed, they had fears, they had trauma, they had all these things, and it was kind of trickling down to their kids. And it was just so much easier to see the reflection in the children than it was in themselves. that this correlation between their child's symptoms and their own experience just became really, really hard to ignore.
It's so interesting because I feel like as a parent, it really makes me want to think about how I act in front of my kids and the things I say that I'm worried about in front of my kids.
Yep.
Because it's true, your kids pick up on your energy. I always say they're little kids with big ears.
Yeah, that's a great way to say it. That's totally what they are. Little kids with big ears.
So do you feel like, I'm just going to say this with the pandemic that we've all been going through, do you feel like that's played a pretty big role in the increase in anxiety that you've noticed?
100%. 100%, yes. There's been an increase in it. My pause in it is that I've noticed a couple of things. And I think the first thing is that a lot of times people will come in looking for or seeking out help for anxiety, and it's actually stress. And so the first thing that we do when we're looking at symptoms is like, is this stress? Like the pandemic created, I think, stress, right? It created people were in their homes more. There was a lack of childcare. There was a lack of all these community supports, which like we need a village to help raise our children and have our families. And our village was suddenly turned off. And it created stressful situations. And from the stress can create symptoms of what we would look at as anxiety, right? Which are those feelings that are a little bit less tangible. Like we can't really define why they exist. They're kind of harder to pinpoint. And so I think what happened is the pandemic amplified probably problems that were already going on in homes and with people. It just put a huge magnifying glass on them because we didn't have any of the supports in place that help us emote, right? That help us have feelings that are natural and normal. Like some levels of anxiety, some levels of stress are natural and normal, and we should feel them.
Right. It's true because I think with anxiety, we always say that we're meant to have a little bit of anxiety. Mm-hmm. If we didn't feel any stress internally, we wouldn't have any motivation to do our homework or to get things done or to get out of bed in the morning. So a little bit of anxiety can be a good thing, can be a motivator, but I agree. Too much of it can definitely have negative effects.
Yes. And we look at that difference between like when anxiety crosses the line between that normal and natural feeling and when it becomes something that's really invasive and that's actually getting in your way of living the life that you want to live. And that's when we treat it like a mental health problem or something that actually needs to be treated versus an emotion that needs to be learned.
So is that when, so somebody calls you and they want to be treated for anxiety or they want your help, is that what you, like if somebody's listening right now and they're trying to figure out if they should reach out to a therapist, what's normal, what's not, you would say, just paraphrasing, that when it becomes invasive in their day-to-day life, that's when they should be reaching out?
Yes.
Okay.
100%.
Do you have any examples? Like, should they be losing sleep? Should they be, relationships having issues? What kind of common scenarios do people call you with?
We get called with all sorts of scenarios, but I would say that like for whoever would be listening to something like this and who would be looking at when am I supposed to call for help? Because we hear that all the time. That's generally the first call is, I really don't want to screw up my kids. I'm not really sure if they even need to be seen, but this is what's happening and right. I don't know. And so generally what we do here at Village Wellness is we do a consultation call. And in that, we kind of walk through what are we seeing. So some common things that we might hear are school refusal, pulling away from friends, performance anxiety, lower grades, just this like there's an energy, behavior problems. There's an energy that feels palpable, like in the entire family feels it. People are walking on eggshells.
Yes.
Those are feelings that are invasive, right? That they're harder to pinpoint, that it's more like, oh man, what am I going to get today? How's my kid going to wake up? Those that's when we want to intervene. That's when we want to provide different types of support.
And I love what you said. People call and say they don't want to screw up their kids, because I do feel like that's every parent's nightmare.
Yeah.
Or what we really worry about is we just don't want to screw up our kids.
100%. It is. I would say most of the time, most of our calls for help come from moms. And it is the first thing that they say. I really just don't want to screw up my kids. I don't want them to feel how I feel. That's one of the things we hear first. I don't want them to feel how I feel. I don't have the tools, and I don't want to screw them up.
It's interesting because when you say they don't want them to feel how I feel, it goes back to what you're saying, how so much of it comes from the parents.
Yes.
Or may come from the parents.
Yeah.
So then what kind of things can you do? So somebody calls you and makes an appointment. As a therapist, what kind of tools do you offer parents to help? And do you see it make a big difference?
We see it make a huge difference. But what I want to do is I want to back up, I think, for a minute before I get to these are the things that we can do. I think that there's an important piece that we can't really ignore, which is the correlation between even making that phone call, right? A parent even making that phone call into okay, here's the things that we can do. And I think that I don't want people to listen to this and freak out, right? That, oh my gosh, kind of like you said at the beginning, how am I talking to my kids? What am I showing them? What am I doing to contribute to the way that they're feeling? That I don't want there to be any shame in that. So I want to make sure that that's really clear. And I want to also make sure that there's also just a general understanding that our feelings are supposed to affect our kids, that kids learn how to emote. They learn how to model behavior and emotion by watching us. And so it's not a bad thing. So we also don't want parents to be these blank humans that don't have any emotion. Your kids are supposed to see you cry. Your kids are supposed to see you stressed and anxious. Your kids are supposed to see you happy and excited and all the feelings. They should see them all. Right? That's not screwing up our children. I
love that you say that, because I think when we're sad or angry or frustrated, I would think I'd want to hide that from my kids and protect them. Mm-hmm. But that's such a great point that you make, that for them to see it, it normalizes these feelings.
That is the entire conversation, right? Is normalizing them. So that's what we do, right? That is okay, well, what do we do? So whenever you start in any sort of mental health, behavioral health treatment, there should be a period of time where you're simply doing what we call psychoeducation, which means teaching about emotions. It means teaching about our natural biological instincts to emotions and the way that we act and react to real or perceived threats. That's what we would call anxiety, and to life's other stressors and things that happen in our life. So we do the initial contact is that consultation phone call. We make sure that you're even a candidate, right? That what you even want to do is something that we can help with. If we can't, and kind of something I see as a really great flag for therapists is if you call somebody and they tell you after talking to you that they can't help you, that's not because they don't want to work with you. It's because they want you to end up with somebody who actually has the right skills. So make sure whoever you're calling, whether it's us or somebody else, that they're asking you and them are asking the right questions, and that you're really making sure that they know how to help with what you need. So just kind of know that piece of it. So somebody's going to call in, they're going to ask for help. We're going to do a significant amount of psychoeducation. We're going to teach you about all of those responses that your body is going to have naturally, that a child's body is going to have naturally. There's some neuroscience-y stuff in there too, because it's used to not be my favorite, but it is kind of a super interesting field, especially when we can bring it down to a level that's digestible and not as sciencey, that it's kind of cool to understand what's happening with the developing brain and with our brain too. So we do all of that first.
I love that. That's great.
Yeah, it's really fun. And then it helps normalize it, right? Then a lot of times parents are like, wait, my kid's totally normal. Oh, they're going to grow out of that, or they're going to learn that, or okay, maybe it's not such a problem. And then it's like done, right? Then they've gone with this level of understanding of some of what I'm seeing and what I'm worried about is actual normal development. And maybe if I teach my child about it, and teach myself about it and my family, the eggshells start to dissipate.
I'm thinking as you're talking about how many kids I see where they're crying. I'll see them crying in the office, and a lot of parents will say, "Stop crying.
Mm-hmm.
Please stop crying. Stop crying." And that's probably, from what you're describing, not a great response, right?
Not a
Because
great response.
you're ignoring their feelings, and their feelings should be justified.
Yes. Yes.
So,
So what we would say instead of,
what should we do in that scenario?
it's a great question. And instead of saying stop crying, I mean, one thing that we can do is just go in for a hug. Like think about yourself in those moments. I think about myself, and if like my husband were to say to me, stop crying, I'd probably cry harder.
Mm-hmm.
Yeah,
So true.
a lot harder for me to shut that down. That like your parent is your safe space, and my child is one of those crying children in your office. And the reason I'm asking him or would be asking him to stop crying is because it's making me uncomfortable. Because I'm worried that he's disrupting everybody else in your office, and I'm worried that like, what does this look like for me, that I like can't control my kid. So
It's
I would
so fascinating. It's true.
Yeah.
We worry about what are people around us thinking. Are they
Mm-hmm.
judging us?
Mm-hmm.
And it
Are
really
they judging?
shouldn't matter.
No, but it's natural because
Right.
I think some of it's generational, right? Like I was certainly, I think, less emotive as a kid than I am as an adult, partially because that's the culture that we just lived in, that it wasn't as normal to validate emotion, to show emotion, to have emotion, and that has changed with generations. And so if we're asking, okay, what should parents do? I would say the first thing is you do like a quick body scan of yourself. Why am I uncomfortable? Why do I want my child to stop crying? And if it's about you, the best thing that you can do is realize it. Maybe put your feet on the floor, ground yourself to space and time, which is like a huge tool that we use in treating anxiety, which is just notice what's around you, pay attention to what's around you, just ground yourself. Feet on the floor, best way to do it. Pick up your kid, or if they're an older child, lean into them and hug them and say like, yeah, I hear you. Is there anything I can do to help? Oftentimes that question in and of itself will change a child's behavior 100% because they feel like they're seen and heard.
Just saying, I hear you.
Mm-hmm. Just saying, I hear you.
Great tip.
Mm-hmm. Yeah, just be present, 100% present for whatever the uncomfortable emotion is.
I like how you're painting this picture because I think a lot of us listening can all relate. Just as anybody who has young children, you're going to have a situation where there's big emotions, maybe in a situation you don't want to see them or you're embarrassed.
Yeah. Oh, yeah. Mm-hmm. I'm that parent all the time. I have a big emoter, and it's really hard. And I think that's also why people moms specifically make that initial phone call, is because it's really hard for them. We don't know what to do. We don't know how to manage it. And we realize there's a problem. And part of that problem is us. And so in that is the flip side of the coin, which is, well, then you're also an enormous part of the solution.
The parents, yes.
The parents, yep.
So, and would you say that is how you've delved into treating more parents?
Yes. Yes.
Okay.
So if you like go back to the beginning of this conversation and look at kind of that evolution, that's exactly what it is that people bring their child to therapy, or people go to therapy themselves, not to have like this amazing relationship with their therapist, but to learn how to have amazing relationships with people in the rest of the world, right? Like you come to see someone like me because you want to get over your social anxiety. You want to learn how to have a conversation, right, with somebody. You want to learn how to walk into a situation and not feel super awkward. You want to learn how to have your kid ride in an elevator, or you want to learn how to like let them go to school without having an enormous amount of separation anxiety in the morning, or be fearful that something terrible is going to happen to you. You want to teach them how to do that in the real world. And therapists are trained, we are trained with those skills to teach a child. However, when most of the time when we have a child in our room, we don't really see those things, right? We're getting a report from mom and dad of what's happening,
Right.
or maybe getting some report from the kid of what's happening, but we're not like seeing the behavior.
Right.
So what I found was that it was better. It was, I don't know if easier is the right word. I want to say it, but it's not. It was a better solution to equip a parent with all of the knowledge to deal, or a caregiver, to deal with it in the immediate moment, right in the moment when it's happening, than it was for me to give a kid who's activated, right? Which means if you go to the neuroscience stuff, right, if we're activated, then we don't have access to our problem solving skills, right? If we look at our upstairs and downstairs brain, right, one of those parts of our brain is turned off, where our problem solvers are. They are not going to be able to recall the skill they need to move through the problem, but their caregiver is. And so if we gave the caregiver the skill, it made that child feel more secure. It made them know that their grown-up could help them through a problem. And it actually like made change in the moment, versus let's hold on to these feelings and talk about them later. If that kind of makes sense. So that was my evolution. However, that isn't the full picture, right? Like there are still children who need to be treated. And so then out of that kind of grew this larger model of, all right, well then we need providers who are specially trained to deal with these various members of a family, to give them what they need. So that if you do that, you're the caregiver and you have all these tools and you're doing it in the moment and your child is still suffering, then you need to bring your child in, and you need to work with somebody collaboratively, so that your child is learning to trust you, that the other adult, the provider in the room, is transferring the knowledge in front of the child, that you guys are working as a team to solve the problem. So out of that kind of has all these different arms of people who we work with, who are all in relationships with each other and with various members of society, and how we all kind of function together. So
that's great. So you can offer help to not only the child, but the parents as well, and the whole
child, parents, siblings, grandparents, caregivers. It's a little bit of everything.
It's wonderful. Really, it's such an important service.
Yeah.
So one thing we talked about previously, or the last time we talked, was how you've done a lot of work recently with moms, particularly working moms that have younger children, because so much stress you've noticed a theme of stress and anxiety amongst working mothers.
Yeah.
As you and I can relate to this topic, what kind of tips would you advise for working moms out there that are feeling stress? Like, are there any, I know this may sound like a loaded question, but are there any like kind of broad tips that you can offer anyone listening, as help?
Oh, that is such a loaded question. And I wish I had an easy, unloaded answer. I do not.
Yes, makes sense.
What I would say is that the first thing that I often tell people to do is to lean in to the feeling. I think it's our natural instinct to run from a feeling. Like, all right, if I'm feeling super overwhelmed, I'm super guilty of this myself. If I'm feeling super overwhelmed, my initial instinct is to procrastinate, to be like, I am out, and to run. That is a retreat. I'm going to run away from all these things that are overwhelming me. And I'm going to go get a manicure. I'm going to go binge watch something on Netflix. I'm going to go do something to retreat from a feeling that's uncomfortable for me.
Right.
So
yeah, I'm definitely guilty of that. Sometimes my husband will find me sitting, I'll park in the garage and he'll find me in my car and he's like, why didn't you come in the house? I'm like, I just need 5-10 minutes, just quiet time in my car.
Yes.
So I admit I'm definitely guilty of a little bit of running away.
100%. You will like find me just doing all sorts of random things to avoid whatever I really should be doing.
Right.
At all times. So that is a common theme.
Okay.
And then what that does is it creates more overwhelm, right? It creates more of this feeling of like wanting to retreat more, to get away from more, but all the more is just getting added onto our plate. So what I say is first lean in. So what lean in might look like is saying, all right, I feel really overwhelmed and I'm super uncomfortable. Why? And just kind of asking the why. And some of the things that we hear are, there's too much on my plate. I don't have enough support. I see all these people on social media and they like have it all together.
Right.
And their lives are perfect. And mine is like a hot mess over here. That there's some right way. I read this book or I listened to a podcast or read this article and I'm screwing up my kids. Like I'm totally doing it all wrong. I'm going to make these massive mistakes.
Right. Always goes back to screwing up my kids. Right.
Always goes back to that. And I think part of that thread is that a lot of, particularly the women that I work with, I tend to work with a lot of either pregnant and postpartum moms. However, they tend to be pregnant and postpartum moms who have like planned their life. They tend to be people who are, 30s, 40s, who are considered like older. I'm air quoting it because I fall into the category too. Older moms, where they have like waited to have kids and they have careers and they have financial stability and they like planned all this stuff out thinking I'm not going to make a mistake or screw people up. Still to be left with all of those feelings. And so that leaning in to them and doing the thing that they've probably been doing most of their life, which is like some planning, actually helps decrease the feelings, if that makes sense.
It does. It definitely does. I feel better when I make a plan, when I have a list and I look at what my week's going to be like and I have a plan for the children.
Yeah.
Things seem much more in control.
Yes. And I would add to the plan of like, my plan is this week is to like unfollow a social media account that I find myself constantly comparing myself to and making me feel bad about myself. Like those are other little self-care things we can add in to plans, that, if we feel like we have all these balls in the air and they're all falling, to be able to reframe it and to say, okay, I have this basket and not all these balls fit into it. So which ones can I intentionally put down this week? Like making those conscious choices, but the only way you can make them is if you lean into those harder feelings.
I think that's I love the tip about just pulling away from social media a little bit. I think I find even if I take a break for a day or two, it definitely frees up a little bit of time and you find that you can focus more on your family and yourself.
Yeah. And you feel better
paying
attention to the needs you actually have versus the ones that society or the algorithm is telling you that you should be having.
Right. I got a tip once from my husband and I have friends that are older than us. They're sort of, they're my husband's work mentors. And they told us that when you have children and you're also invested in your career, that you can't really do either one 100%. You have to have a realistic goal of doing maybe each one like 80% well. And I liked that advice because it made me forgive myself if I'm not doing things as perfectly as I want to in my mind. So just, another tip I'd throw out for myself personally, just being a little forgiving if you can't do everything exactly as you've planned.
100%. I would maybe amend
Yes, please.
that in, yeah, amend's an okay word to use for it, I guess. And that I'd actually say, versus not being able to give 100%, I would say instead to be realistic with your time. So like when I'm at work and it is the time that I have carved for me to be at work, not wearing a mom hat, I'm at work, that I give 100% of what I have when I'm present there. And
Yes.
so when I need to take my mom hat off,
Yes.
then I need to go home, or my work hat off, I need to go home and I need to be mom. Then I need to figure out how to be 100% in those moments. And
Yes,
if that's
absolutely.
okay, I'm also a business owner and, like I kind of have to have a worker's hat on sometimes, then I also need
Yes.
to like carve time. So in that you can't do it all 100% of the time. To
Right.
me, that feels more forgiving of just like, no,
Definitely.
I can still have a career and have friends and have my family and feel okay and fulfilled and effective in each of those areas if I actually protect my time that I'm giving to each one. If that,
Yes, I 100% agree with that. When I'm here at work, I'm all about work and the patients and doing a quality job.
mm-hmm.
And I think that feels better. You don't want to feel like your focus is, all over the place. You want to do a good job. You want to be focused on
Yep.
the task at hand. I
Yep.
think I meant more like in my early years working, I felt out of balance, and it took some configuring to figure out how to make the balance right. Like
That.
one big thing that helped me was I used to work long days on Fridays.
Mm.
Fridays are a popular day to come, like for patients, they like to come in Fridays
Yes.
before the weekend. And I started leaving early on Fridays, and that just ended up feeling better. I felt a lot more in balance, even though
Yes.
I struggled with it because, to make work feel 100%, I know that patients, there's a nice, they would like it if I was here, but
Mm-hmm.
to be the best mom I could be and be the best doctor I could be, I had to pull from somewhere.
A
So I guess
hundred
that's what I
percent.
mean by the 80%.
I love that. I think that's exactly, you're creating boundaries, and your boundaries are working for what works for you and your family, not necessarily what might work for like all the people that you serve, which actually makes you more effective for all the people that you serve. And so part of that is the work, right? Of realizing, what do I need and how is that going to make me better, and these categories that are important to me. Um,
Right.
and
It
if you
took me a while to
pull,
figure that out because if you burn out, then you're not doing a good service for anybody, your family
no,
or who you working for.
it's that. I was just, you took the words out of my mouth, right? If you pull it back to how it affects kids, it's that. If you have a burnt out parent, mom or dad coming home and they can't give anything to their family, then like, what's the
What good
point?
is that?
Why'd you
Yeah.
come home, right? You should have just stayed at work at that point.
Right.
And so that is when we say that there's this, so much of that work comes from the parents, it's because that's what trickles down. So if you come home super overwhelmed, your kids are tuning forks to that. You're just raising overwhelmed kids who think that's normal, that you're supposed to like constantly be busy and constantly be on edge, and you're not.
I love that. So there's permission to have downtime and relax time
Yes.
and play time.
Yes.
I feel like society now, everybody's, or not everybody, but the feeling is everybody's overwhelmed
Mm-hmm.
and busy and constantly working. And that's probably not healthy for kids to model after. I don't
No,
think.
it's a very American sentiment, right? That like it's a good thing to be super busy and to have so many things going on. And I would love a shift to be, it's good to give your all and it's good to have a good balance. That success shouldn't be measured by the lack of time you have to give to all these other like fun areas of your life. It should be measured on like how present you are and what you're actually doing. That it would shift so much. And so I think like if you get to the, you've asked the question a few times of like, well, what can we do? If you know all of these things, and it's really comes back down to emotional intelligence. So like if you have people listening to this that are like, all right, back to the, I don't want to screw my kids up. What am I supposed to do? It's creating the space for vulnerability, leaning into uncomfortable emotions, teaching emotional intelligence, which means not creating this environment that's totally stress-free and feeling free, but creating an environment where you're labeling feelings, where you're like accurately identifying your own experience and what you need to make it feel better, to like to really, really lean in to that part of helping them know how they're feeling and normalizing it, so that when they're scared to come to the doctor's office because they might get a shot, that's my kid, that instead you spend time having a conversation about like, okay, these are feelings that you might feel when you go there. How do we act it out? How do we talk about it? How do we use play, right? How do we use play, and how do we use natural conversation to like expect uncomfortable feelings and then learn how to cope with them? And all that is emotional intelligence.
So so if your child is fearful of something, you'll walk them through the scenario and what their feelings are and what it might look like.
Yes.
And that helps them with preparedness, or it helps them?
That it helps them. Okay, so I think what we do is we say, I'm going to use my own child as an example, the one who screams bloody murder walking into your office, except for last time we did a better job. And that was not him. That was myself and my husband, right? That was us saying, instead of, okay, don't worry, they're not going to give you a shot, you're going to be totally fine, don't worry, to instead say, you're worried, right? You're worried. Last time you went there, this is what happened, and you're really scared, and I hear you. All right, so what are we going to do?
This is so good.
What's going to happen? What's the doctor going to do when she walks into the office? Like walking through it. And if you don't know, don't guess. Call. Like pick up the phone and call. If you're going to a therapist, call and say, what can my child expect in the first visit? And let somebody tell you so you can accurately and appropriately prepare your child. Same thing coming to the doctor. They can call your office or anybody's office and say, you guys giving shots on this appointment? Like, what's going to happen?
Yes.
If it's like a routine physical, something like that, like what's going to happen so that I can prepare my child? Saying to the nurse, saying to anywhere you go, a provider, like, hey, this is how I'm feeling. I'm really uncomfortable. Can you explain to me what's happening before you do it? Or can you show my child the instrument that you're going to use to look in their ear beforehand? It just validates their feeling instead of them thinking like, there is something wrong with me for feeling uncomfortable. There's not.
And the doctor's office can be so uncomfortable. I mean,
so uncomfortable.
Yeah, there's shots and we're taking their clothes off and looking everywhere. Yeah. I think you're right. I think that's a really good tip for providers to make sure we try our best to explain, especially with a kid that's more fearful, before we do what we're going to do.
Yeah.
I see a lot of parents, they'll come in and they don't want their kids to be scared of shots, so they don't tell them until I say they're going to get a shot today. And then there's a big, it's a big emotional outburst. And so you would advise against that. I think this makes sense. Ahead of time, better to prepare them.
So I'm going to be very, very honest here because I'm a big fan of transparency. I've been that parent. I have tried that route. And it doesn't work. And I think, again, what it is if I speak from my own parenting experience, it was for me. I didn't want to deal with, all right, now we're going to cry and we're going to fight going into the car.
Right. That's exactly what it is. It's putting it off. Yeah.
100% for me. Right. And it doesn't work. All those things are still hard. And then in perpetuity, your child doesn't trust you, right? They don't see you as that secure base who actually can help them solve their problems, which is the entire reason you come to like therapy or do something, is because you want to be able to solve your kid's problem yourself. So being authentic with them, being honest with them, even just saying, I don't know if they're going to give you a shot today, but if they have to, here's some education about a shot, right? This is what it is. This is why you get it. Like, here's a syringe without a needle, right? Like practice giving some shots to your stuffed animals, right? Like this stuffed animal is sick. This is what happens when we get really sick. It comes back to that education that prepares and makes kids more comfortable. And that is a parent's job, right? That is your role as a parent, is to help prepare them to be successful in the world. And that's all education.
And I think as a parent, it can feel really good. You know, if you take the time to walk your child through something that they're maybe fearful of, and then you see the next day that it's easier on them, and it was helpful, it's such a rewarding feeling, I think.
So empowering. It's the best feeling. Yeah.
This is so awesome. Thank you so much. Are there any other tips that you can think of, or anything we didn't cover that you would like to offer to anybody listening out there?
I mean, we could probably have this conversation for hours longer.
I know. I love it so much.
I would say that if there's anything that you take away from it, that it's not to hide from feelings. It's teaching people how to feel. And I would say that it's also knowing when to ask for help. And so if you get stuck in anywhere, that whether it's therapy, whether it's tutoring, whether it's a doctor, whoever it is, there's so many supportive services out there for parents and for families. And it can be really hard to muddle through social media and Google to find what's going to work for me. And what I would say to do is just to stop and pick up the phone and call a friend that you trust. You can call us, right? You can call you. There's a million healthcare and mental health care providers that you can pick up the phone, and you get to interview us. Chances are there is somebody who can help you, even if that means that it's you don't really need to go in for treatment, but you can go in for, an hour-long conversation to problem solve one problem. Just ask for help when you don't have what you need instead of trying to find it. Normalize it. That teaches your kids to ask for help. It teaches your community of other moms who are also scared and shamed that they're not doing their best, that everybody struggles, and just ask for help. So I would say that's that one area that I cannot drill home enough, is just reach out.
When I'll recommend therapy for families, or we'll talk about therapy, they envision, is this going to be for years, for my life? And such a good point that you can even just go for one session.
100%. That you, don't get me wrong, I think that there are some providers who are going to psychoanalyze you, right? And those are analysts. That is their job. That is the type of provider that they are. And people who seek out that type of therapy love it. And it can be really, really helpful and rewarding. Chances are that's not the therapy that you're seeking out when you're seeking parenting support, or when you're trying to deal with overwhelm or kind of life stressors. Chances are you're looking for something that's a bit more about solutions. And solutions-oriented therapy has a time limit on it, right? That we're looking at a limited number of sessions or a limited amount of time. You should be working towards real tangible goals. It should be collaborative. You should know exactly what your investment is going in, meaning insurance and cost and things like that. Your provider should be able to give you all of that information. And you should explain it to your children. We go to school to learn how to read, right? And we go to school to learn how to take turns and to do all of these things. And therapy is really just emotion school. That's it. There is it doesn't have to be pathologizing. We're not going to smack a label on you that you're going to have to carry around forever. That it's really just teaching emotional intelligence. And so that stigma, collectively, when we start asking for help, that stigma will start to go away, hopefully.
Absolutely.
So, send people to emotion school.
I'm going to try leaning in when I get home today.
Good.
Instead of running away, I'm going to try leaning in. Okay, so I just wanted to let everybody know they can find you, Lori Allen. She's at www.villagewellnesscounseling.com in Thousand Oaks, Southern California. And you can also, if you're not near Thousand Oaks, you can also schedule televisits.
Yeah, 100%. So throughout the state of California, and then to come, hopefully early 2022, is a bunch of courses on emotions and parenting and supporting all the members in the family. So even if you're not in California and we can't work with you therapeutically, you can still kind of download our information.
Thank you so much. Thank you for what you do. Thank you for the help that you provide families. And I so appreciate you coming on today.
I appreciate you too. Thank you for having me.
Of course. Thank you.